Benzoyl peroxide products are commonly used to treat mild to moderate acne by reducing acne-causing bacteria and causing the skin to dry and peel. Some brands can also be used to treat a skin condition called rosacea, helping to decrease symptoms such as pimples and bumps on the face. It's important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. Before using this product, it's important to check if you are allergic to it. To do this, put a small amount on a small area of acne for 3 days. If you have an allergic reaction, stop using this product and get medical help right away. If there is no allergic reaction, you can continue to use the product. There are many benzoyl peroxide products available, some of which may require a prescription. It's best to consult your doctor or pharmacist to determine which product is best for you. If you are using an over-the-counter product, be sure to read and follow all directions on the product package before using the medication. If your doctor has prescribed this medication, use it as directed. When using cleansers containing benzoyl peroxide, wet the affected area, gently rub the cleanser into the skin for 10 to 20 seconds, work into a full lather, rinse thoroughly, and then pat dry. If too much drying occurs, you may need to rinse the cleanser off sooner or use it less often. Always consult your doctor or pharmacist for further details. The dosage is based on your medical condition and response to therapy. Improvement in acne or rosacea is usually seen after 3 to 4 weeks of use, and maximum benefit after 8 to 12 weeks of use. Do not increase your dose or use this drug more often or for longer than directed. If your condition lasts or gets worse, be sure to seek medical help right away. When using acne foaming wash cleanser, you may experience skin reactions such as peeling, itching, irritation, and reddened skin, especially at the beginning of treatment. If these effects persist or worsen, it's important to consult with your doctor or pharmacist. They may recommend using smaller amounts of the product or using it less frequently. Your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. While serious allergic reactions are rare, seek immediate medical attention if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, consult with your healthcare provider. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this acne foaming wash cleanser, it's important to talk to your doctor or pharmacist if you have any allergies to benzoyl peroxide or any other ingredients in the product. Be sure to also discuss your medical history and any other medications, including herbal products, that you are currently using. If you are planning to have surgery, make sure to inform your doctor or dentist about your use of this medication. It's important to note that this medication can make you more sensitive to the sun, so it's best to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when using acne foaming wash cleanser. This could affect how well your other medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with acne foaming wash cleanser is Dapsone, which is used on the skin. Always consult with your healthcare provider before using any new products to ensure your safety. If this medication is swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can reach their local poison control center at 1-800-222-1222 while Canadian residents can call a provincial poison control center. Make sure to use this acne foaming wash cleanser regularly to see the best results. It's important to stick to a routine and use it as directed. For best results, use it in the morning and at night. This will help to keep your skin clean and clear throughout the day. It's also important to continue using this cleanser even after your acne has cleared up to prevent future breakouts. And don't forget to follow up with your doctor or dermatologist as recommended to monitor your progress. If you forget to use this product on a regular basis, use it as soon as you remember. But if it's close to the time of your next dose, just skip the missed one. Use the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing your acne foaming wash cleanser, it's important to keep it at room temperature. Different brands may have different storage needs, so be sure to check the product package for specific instructions, or ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When you no longer need the product or it reaches its expiration date, it's important to properly discard it. Instead of flushing it down the toilet or pouring it into a drain, consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.